I have a question for you. A 44-year-old patient with a history of schizophrenia is brought to the emergency department due to severe muscle rigidity, high fever, and altered mental status. His family mentions he recently started a new medication. So, which dopamine receptor pathway and subtype is primarily responsible for both his psychiatric treatment and these severe side effects? You will learn the answer to this question after watching this video. Today, we will be talking about dopamine receptors of the central nervous system. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. There are a total of 5 types of dopamine receptors. These are divided into two categories, the 1-like and the 2-like. The 1-like receptors are D1 and D5, while the 2-like receptors are D2, D3, and D4. But in this video, we will be talking about dopamine-1 and dopamine-2 receptors. Now, let's start with the dopamine-1 receptor. Dopamine-1 receptors are located in the striatum and cortex, helping control movement and cognitive functions. But from a pharmacology and exam standpoint, their peripheral action is incredibly important. So, these receptors are located on the smooth muscle of our blood vessels, especially renal arteries. Are you wondering how to remember the dopamine 1 receptor? It's simple. So let's remember. D1 gets the renal blood flow done. Let's set up the equation then. Dopamine 1 equals done. But how? As you may remember from my previous video, mechanistically, dopamine 1 is a GS-coupled receptor. When dopamine binds, it activates adenylyl cyclase, boosting cyclic AMP levels. In vascular smooth muscle, this increase in cyclic AMP causes relaxation, leading to vasodilation. Activating peripheral dopamine 1 receptors dilates renal blood vessels, which increases renal blood flow and helps protect kidney function. Alright guys, now let's talk about dopamine 2 receptors. Before we jump into our memory trick, let's understand the core physiology of dopamine 2 receptors. Unlike dopamine 1, which is mostly postsynaptic, dopamine 2 receptors are found both postsynaptically and presynaptically as autoreceptors to regulate dopamine release. In the brain, they are heavily concentrated in the striatum for motor control and the limbic system for emotion. Are you wondering how to remember the dopamine 2 receptor? It's simple. So, think of D2 turns the signal down. Let's set up the equation then. Dopamine 2 equals down. Since dopamine 1 receptor was stimulatory because GS coupled, dopamine 2 receptor is its exact opposite. But how? As you may remember from my previous video, mechanistically dopamine 2 is a GI coupled receptor. When dopamine binds, it shuts down adenylyl cyclase, dropping cyclic AMP levels, opening potassium channels, and hyperpolarizing the cell to inhibit firing. Clinically, where does this matter? In schizophrenia, dopamine activity is way too high. To treat this, we use antipsychotics that block these dopamine 2 receptors. Let's go back to our question. Patient with a history of schizophrenia, severe muscle rigidity, high fever, and altered mental status. He recently started a new medication. So, which dopamine receptor pathway and subtype is primarily responsible for both his psychiatric treatment and these severe side effects? This classic clinic presentation is neuroleptic malignant syndrome, which is life-threatening reaction to antipsychotic drugs. The responsible receptor is dopamine 2, and the clinical presentation is caused by blocking dopamine 2 receptors in two specific pathways. Firstly, blocking dopamine 2 in the nigrostriatal pathway causes severe muscle rigidity. Secondly, blocking dopamine 2 in the hypothalamus ruins the body's thermostat, causing a dangerously high fever. And that brings us to the end of today's topic. Now, that you have mastered the core functions of dopamine receptors. It's time for today's high-yield challenge. If you are ready, here comes today's question. Which class of drugs blocks dopamine-2 receptors in the pituitary gland, leading to increased prolactin levels and symptoms like galactorrhea? I will be waiting for your answers in the comments. See you later.